And then here's an overview of our agenda, what we have planned for the day. We have a few speakers whom I'll introduce in a moment. As questions arise, just as sort of housekeeping, as you develop questions in your mind, please write them into the chat. We plan to leave time at the end, and Amanda will facilitate a question and answer session at the end. So that will be helpful. And yeah, so I think I'll introduce our speakers. We have with us Lauren Cullum. She is a policy advocate with Sierra Club, California, working on policies associated with energy, climate change, and air pollution. And she advocates on behalf of the environment and disadvantaged communities impacted by these issues at the California legislature and state agencies. And next, Christine James. She's an allergy immunology physician who has done research on indoor and outdoor air pollution and air quality as associated with respiratory disease. She is helping to lead the Building Electrification Initiative at Climate Health Now, and is a member of the Public Health Advisory Council of Climate Action Campaign. Martha Arguello is the Executive Director of Physicians for Social Responsibility, LA. She has served in the nonprofit sector as an advocate, community organizer, and coalition builder. And she's committed to transforming California and our planet into a more peaceful and healthy place. And lastly, Brady Seals is a senior associate in Rocky Mountain Institute's Building Electrification program, where she works at the junction of air quality, buildings, and human health. Prior to this, she spent 11 years working on clean cook stoves and indoor air pollution in over 16 countries. So she is quite the expert on the topic we are about to start. So Brady, if you'd like to kick it off.
Rena, so nice to be here with you all today. Thanks for having me. So just to start, many of you may have seen this hashtag electrify everything. And the subtext, I think, for us is for climate and health. So the next slides are really just the so what. Why is decarbonization rising quickly to the forefront of our minds, and what does health and climate have to do with it? So the good news is that 1 in 4 homes is already all electric. Most of these homes are in the Southeast. So when we look nationally, we see that we are on a way to electrify our buildings. And at Rocky Mountain Institute, we do a lot of analysis around emissions and what is it going to take to align with a 1.5 degree scenario to keep the climate from warming too much. And electrification of homes and buildings and schools is really a key part of that, but perhaps has been a understood or underrepresented part of the climate and arguably health issue. So for those 3 homes, the 3 in 4 homes that are not electrified, what does that mean? And so in the US, we still have 70 million homes and businesses, so 70 million buildings that are still burning gas. And this is significant. It is about 10% of the national greenhouse gas emission inventory. So that's a huge part of it. And so then when we break it down into buildings, it really comes down to 4 appliances in our homes and our schools and offices that are contributing to this climate. So you'll see on the right that space heating, our furnaces, our boilers are a large part of these climate emissions, water heating as well. And cooking is a smaller piece of the climate footprint, but we're going to hear today, it's a larger, potentially much larger piece of the health impacts when we think about indoor air quality, some of the health research about gas cooking. And just to frame it, I know a lot of you are calling in from California, but I mentioned before, 1 in 4 homes is all electric. And when it comes to cooking, one of the reasons we're so interested in looking at the health impacts is because the stoves are often unvented. And so nationally, a little over 1/3 of our homes use gas for cooking, 35%. But in places like California or New York City, that number is closer to 70%. So it really does depend on where you live. 10 states are responsible for 56% of our direct building emissions. So you can see New York and California, and California is adding more gas customers than any other state in the nation at the present. But we have a pretty good geographical representation. We have the Midwest, we have the East Coast, we have Texas. So we do see that from the share of our climate emissions, we have some scattered throughout the states. So this 2 slides on outdoor air pollution, really general, and then indoor air pollution. So since the Clean Air Act was passed in 1970, the emissions of the 6 most common pollutants has decreased 74%. So globally, when we think about emissions, and nationally, largely we have pockets of success. However, air pollution is still our greatest environmental health risk factor in the US, responsible for 100 to 200,000 early deaths. And to put that in perspective, that is more than murders and car crashes combined in the US. And half of those are attributable to fossil fuel combustion. Buildings come into play. Buildings are a source of a number of different pollutants, particularly nitrogen dioxide. I want to talk about nitrogen dioxide. It's sort of a family. Nitrogen oxides, or NOx, as they're sometimes called, is really NO and NO2. And I won't get too much into it, but it is a pollutant of concern, especially from buildings, because it's a toxic, invisible gas on its own, but then outdoors, when it reacts with sunlight, other pollutants in the air, and heat, it also becomes ground level ozone and secondary particulate matter, which are all very health harming pollutants. So I like to think sometimes of nitrogen dioxide as a triple threat, and we're going to talk about that a lot today. So one of the things at Rocky Mountain Institute, when we started looking into building electrification, so this building electrification wave is just about 1.5 years old. So in July 2019, Berkeley became the first city to set up a mandate for all electric new construction. And since that time, 40 cities and communities in California have set some sort of a building reach code or some sort of a mandate for all electric new construction. And that's pretty incredible. That's 40 communities in less than a year and a half. And that represents, I think, Lauren, correct me if I'm wrong later, but I think that's about 12% of California's population now lives in a city or a community with an all-electric reach code. So when we started talking to air regulators about the contribution of buildings, we were actually shocked to figure out that buildings emit as much nitrogen oxides as light duty passenger vehicles. So traditionally, NOx has been associated as a traffic pollutant, which it is, but buildings are a significant source, 5 times more than power plants in California. This slide looks very similar in New York. So we've been using some emissions inventories to make these bubble slides in different states to try to put the buildings sector in perspective, because it's often overlooked in climate plans. So indoor air quality is also a huge issue. So we spend 90% of our time indoors. This was pre-stay-at-home orders and lockdown, so maybe that number is closer to 100% at this point. But it's really staggering. And one fact that I learned that I have to share every time is that we spend more time in buildings than some whales spend underwater. So some whales are coming up for air more often than we leave our buildings. And for that reason, it's somewhat shocking that our indoor air is not federally regulated. However, if you go to the EPA website, the Environmental Protection Agency, you'll see that they state very clearly that our indoor air is 2 to 5 and as much as 100 times higher than outdoor. It's just staggering when we think our homes may be one of the more polluted places that we live. And homes with gas stoves have 50 to 400% higher nitrogen dioxide emissions concentrations than homes with electric. So we'll talk about this, but this is exactly from the EPA statistics themselves, and the gas stove or gas combustion indoors as well as outdoors is a main contributor to potential poor air quality. And just to frame it, when we are talking about gas cooking, we do, no matter what, when we're burning our food, those that might be the pollutants that we're more used to when we see smoke, smell smoke. And a lot of that is from the particulate matter, the very small particles and aerosols that we can often see and smell. Sometimes we can't, but that can come from cooking our food. But gas stoves, so just the presence of gas, they emit nitrogen oxides, carbon monoxide, formaldehyde, in addition to more particulate matter. So just some framing that when we're talking about combustion emissions from stoves, we're mostly going to be looking at this right side here. And then just again, we don't have any federal indoor air quality guidelines in this country. Canada does. They've just revised them. World Health Organization has some guidelines. What is a safe threshold for some of these pollutants? So in the absence of federal indoor air quality guidelines, or really updated indoor air quality guidelines, considering some of the latest evidence that we'll hear about, what we have to benchmark is outdoor standards. And so when you put this into perspective, baking a cake in a gas oven could reach a peak parts per billion concentration of 230 parts per billion. Whereas the EPA has said outside, where again, we spend 10% of our time, it's only safe to breathe 100 up to 100 parts per billion for 1 hour. And I will say that that number probably needs to come down significantly in light of the new evidence. So hopefully this slide gives a disparity from some of the measured events you can see from frying bacon or even boiling water without any food, that we can see very high levels of nitrogen dioxide in the kitchen. So with that, I'm going to turn it over to Lauren to talk about some of our other residential appliances.
Great, thanks Brady. So I'm Lauren Cullum, I'm a policy advocate with Sierra Club California, based in Sacramento. And I'm going to talk about a report that Sierra Club commissioned by the UCLA School of Public Health, released earlier this year. And if you can switch to the next slide. Thank you. So the report uncovers how much pollution comes from gas appliances in California's homes, how this impairs people's health, especially those from vulnerable and sensitive populations, and the extent to which building electrification can help clean the air and protect people. And the UCLA report took a close look at the specific residential gas appliances and how their usage impacts air quality both indoors and outdoors. Overall, and as I'll go into more detail in a second, the UCLA researchers found that gas stoves and ovens are the gas appliances that contribute the most to indoor air pollution, like Brady was just giving details on. And since they're also not typically vented outdoors, like water heaters and furnaces, and the study also found that gas, water heaters, and home heating devices like furnaces are most responsible for outdoor air pollution. So before diving into the details of the report, I just wanted to mention a few facts about what we know. And Brady did mention with the fun whale fact that I always like about how much time people are spending indoors. And yes, that is probably even more so now as people have been spending their time inside to avoid COVID infections. And also, at least in California and other Western states, people have had to stay indoors this year to protect themselves from hazardous air pollution caused by the wildfires. And what we know is that these household gas appliances, such as water heaters, furnaces, and stoves and ovens, emit dangerous levels of a wide range of air pollutants, including carbon monoxide, nitrogen dioxide, and fine particulate matter. And the pollution from residential gas appliances has detrimental impacts on our health and also makes us more vulnerable to viruses like COVID. Yet today, 90% of California households still rely on gas for at least one purpose, and almost 70% are using gas for cooking. So with that in mind, there are a few takeaways that I wanted to highlight from the report. First, the pollution from household gas appliances not only contributes to the climate crisis, but it presents a real threat to human health. These pollutants have been linked to acute and chronic health effects, including respiratory and cardiovascular illness and premature death. The UCLA report found that children, the elderly, and low-income people are most at risk of air pollution from gas appliances. Second, the use of gas cooking appliances can result in hazardous levels of air pollution, which in turn has terrible impacts on health. Acute exposure to nitrogen dioxide in the kitchen from cooking with gas appliances, I believe Brady mentioned this too, exceeds the levels of national and California-based ambient air quality thresholds in more than 90% of the modeled emission scenarios in the report. And the results are even worse for smaller households where air pollution is more concentrated. UCLA researchers found that after an hour of cooking on a gas stove, 98% of smaller apartments had peak levels of NO2 that exceeded these state and national standards. In other words, the air quality inside nearly every apartment was so bad that it would be illegal if measured outside. And that's roughly 12 million Californians in homes with gas stoves that are breathing these levels of NO2. Third, the study also found that gas water heaters and home heating devices like furnaces are most responsible for outdoor air pollution. California has some of the worst air pollution levels in the country. The emissions from gas-fired appliances from inside our homes is a major contributor to this problem. The study found that approximately 12,000 tons of carbon monoxide and nearly 16,000 tons of nitrogen oxides were emitted to outdoor air from the use of residential gas appliances. To put this into further context, the NOx emissions from just residential gas appliances are more than 2 times the emissions from all of California's gas power plants. Fourth, according to the report, if all gas appliances in California were replaced with advanced electric alternatives, the reduction of NOx and PM2.5 outdoors would result in over 350 fewer deaths, 900 fewer cases of bronchitis, and save Californians over $3.5 billion in health benefits annually. And last, the report found disadvantaged communities are disproportionately experience poor housing conditions that are detrimental to health. So lower income families, often renters, don't have the resources to replace and maintain gas appliances, which can cause improper ventilation and or spillage of combustion pollutants into the living space. The housing characteristics that are more common to low-income communities, such as smaller unit sizes and inadequate ventilation, contribute to higher levels of NO2 and carbon monoxide in these homes. And more than 40% of fossil fuel power plants are disproportionately concentrated near disadvantaged communities in California and already suffering from air pollution burdens. And the poor indoor air quality from gas appliances exacerbates the pre-existing complex and adverse environmental and health burdens in these communities. So again, the reductions in air pollution from electrification of residential gas appliances will benefit those communities that are now burdened with the worst air quality. So UCLA researchers looked at where outdoor air pollution from residential gas appliances is the worst. And this slide breaks down the monetized health benefits from electrification of those 5 air basins. And the estimates are only from outdoor air pollution from NOx and PM2.5 and only residential buildings. So the health and monetary benefits would only get better as we factor in replacing propane and wood with cleaner electric appliances, as well as the factor in the electrification of commercial buildings. And that is all. Thank you.
All right, everyone, so I'll be talking about the health impacts. So this report from Rocky Mountain Institute, Mothers Out Front, PSR, and Sierra Club actually synthesizes the last 2 decades of research on this topic. And it offers recommendations for many stakeholders and the public in terms of how we can actually mitigate the health risks associated with gas stoves. Next slide, please. So here's the report summary, and as Brady and Lauren have already touched on this, our indoor air is unregulated, our gas stoves emit pollutants that are dangerous to our health, and children and lower income communities are actually at higher risk. And despite the fact that ventilation is important. It's not the sole strategy. Electrification is really going to make the difference. In places like Canada, for example, Canada has actually some of the most stringent indoor and outdoor standards for nitrogen dioxide. And in Massachusetts, their medical society is actually training their healthcare workers on the links between gas stoves, air pollution, and asthma. And another point is the fact that we really need to prioritize our environmental justice communities because they are disproportionately affected by asthma, which is associated with gas stove use. Next slide, please. So what I really like about this table is the fact that it shows over time how research is showing the relationship between short-term and long-term exposures of nitrogen dioxide and how this affects our health. And obviously we see that the relationship between the respiratory effects is pretty established, but what we're finding is that our cardiovascular systems, our hearts, women who are pregnant and are developing babies, as well as cancer and total mortality are also affected by nitrogen dioxide levels. Next slide, please. So as I said, children are particularly affected by this. So I take care of patients with asthma. And what studies have shown is the fact that asthmatic children are actually at higher risk for more severe asthma symptoms, even at low levels of nitrogen dioxide. And this risk actually increases as the nitrogen dioxide level exposure rises, as well as things like risk of wheezing or having to use medications for asthma increases. And then what we're also seeing is the fact that there's mounting evidence that combustion-related air pollution adversely affects brain development, including increasing the risk for attention deficit hyperactivity disorder. Next slide, please. So asthma is the #1 chronic disease in children. And in California alone, 1 in 7 children have an asthma diagnosis, and this actually increases to 1 in 4 in certain California counties. So for children in homes with gas stoves, they actually have a 42% increased risk of experiencing asthma symptoms if they've already been diagnosed. There's also a 24% increased risk of ever being diagnosed with asthma by a doctor. And this is not an insignificant issue considering the fact that asthma actually costs the US economy more than $80 billion annually in medical expenses, days missed from work and school, as well as deaths. And this is actually according to a study that was done by the by CDC researchers for the American Thoracic Society. And they actually estimated that this number is probably higher. Next slide, please. So why are children more susceptible to illnesses associated with air pollution? There are really 3 factors. One is the fact that they have higher breathing rates and greater levels of physical activity. Their lung surface to body weight ratios are higher, and their respiratory and immune systems are still in the process of maturing. Next slide, please. Now, with COVID-19, there have been studies that have been done that show that air pollution increases the mortality risk from COVID-19. And this study from Emory University just came out that shows a 4.6 parts per billion reduction in your long-term exposure to nitrogen dioxide would have avoided almost 15,000 US deaths among those who tested positive for this virus. Next slide, please. And something else I want to touch upon is carbon monoxide, an odorless gas, which is actually a pretty big issue for some of my patients who actually don't even have their sense of smell from things like nasal polyps, or this may be affected when their allergies are really acting up. So interestingly enough, the United States doesn't actually have a 24-hour guideline or standard, but the World Health Organization has set a guideline of 6 parts per million for 24-hour exposure with carbon monoxide. So when you look at homes, that don't have gas stoves. Your average carbon monoxide levels are between 0.5 and 5 parts per million. But if you're considering homes with gas stoves that are actually properly adjusted, these levels rise to between 5 and 515 parts per million. And then if you have a poorly adjusted stove, that can actually be twice as high, 30 parts per million or higher. And as you can see here, these health effects are very important when you're looking at these levels. I mean, most people, if they are exposed to carbon monoxide for a while, between levels of 1 to 70 parts per million, they're fine. But for a lot of people who may have heart issues, they can experience chest pain. And of course, as the levels rise, and if you're not aware of this, the symptoms can become even more severe and could result in death. Next slide, please. So now I'll be talking a little bit about outdoor air pollution. Next slide. So I just find this statistic to actually be pretty incredible. The fact that buildings are the #1 source of pollution-related premature deaths, up to 28,000, or actually more than that. So a 10% decrease in emissions from our commercial residential sector would actually have a 3.3 times greater benefit than a further 10% decrease in emissions from electric power generation. And this is really reflected in the fact that there's a declining relative importance of sulfur dioxide and an increasing relative importance of primary particulate matter and ammonia. Next slide, please. And of course, as Lauren touched upon this, you know, the importance of switching to electric appliances would really just make such a difference in terms of our health. The fact that, you know, in California, we could save over 350 lives each year and avoid 900 cases of respiratory illnesses annually, which is particularly important for those of us who take care of patients who do have chronic respiratory diseases like asthma and COPD. Next slide, please. And of course, the health cost of gas appliances are so important. You know, that right now in California alone, we spend $11 billion per year. But if we did switch to electric alternatives, we could actually save $3.5 billion in healthcare costs. And if you just look here, the fact that annually per person asthma costs are $3,000, but then the cost of an electric stove would be $500 to $1,000, I think just gives a really good perspective of how important this intervention could be. Next slide, please. And as touched upon earlier, our lower income households are at higher risk. They already experience a greater asthma burden, and this is just exacerbated by their home environments. You know, they live in smaller unit sizes that tend to be older with inadequate ventilation. You have more people who live at home with you, and the fact that, you know, sometimes they use stoves and their ovens for supplemental heat. And many of these buildings are in areas where they are exposed to higher levels of outdoor air pollution. So all of these factors make this issue, you know, something that's very important to address for their health. Next slide, please. And actually, there was a study that looked at how if you green a public housing unit, could this help with the health benefits? And what they found is that the nitrogen dioxide levels actually decreased by 65%, and particulate matter also decreased by about 60%. And the subjects who were involved in this study reported that they felt like their health symptoms had improved with these changes. Next slide, please. So now I'm actually going to turn it over to Marta Dina Arguello, who will talk about our health equity lens.
Good afternoon, everyone. Marta Dina Arguello, I'm the Executive Director. Let me put myself on screen so you could see me. The Executive Director of Physicians for Social Responsibility. And, you know, for the last 20 years, PSR has been developing a deep alliance with the environmental justice community. And in many arenas, in terms of policy, often we are bringing both a strong health voice and the reminder that you've got to also focus on the folks who are most impacted. And so we've actually heard the data in terms of who is most impacted in terms of health. But we should also remember for that that communities have a cumulative, most Black and Indigenous and communities of color have cumulative exposure. So next slide. So what does it mean? Next slide. What does it mean to have, when we talk about energy justice and health justice? And what does it mean when we ask, how are we going to have an electrification policy, deep electrification that we need for all the reasons that we've just seen, for the health reasons, for the climate reasons, but how do we make sure that environmental justice communities aren't left behind, right? If our policies focus on new buildings, new homes, and new multi units, who does that benefit? So will we end up driving the gas appliances deeper into, for lack of a better word, and I hate it, but I can't think of another one, the bottom of the market, right? In Los Angeles, 22% of the residents in Los Angeles live in ultra low income housing. So even when we talk about affordable housing, we're still leaving a large part of the communities out of the conversation. And the other thing that is important to remember as we develop these policies is that what we've seen, particularly in California, with extensive investments through the cap and trade program, often those programs have not benefited ultra low income communities. And in this particular case, renters, right? So we know from experience that rolling out the solar roofs initiative, even though the environmental justice community warned CARB and others that they needed to focus on equity, have wraparound services, make sure we were adding upfront cost, and taking into consideration the aging housing stock. And so those have been some of the barriers to solar roofs, and are also providing us, some indication of where we need to do better. And so we've been, I am a member of the Environmental Justice Advisory Committee and have been working with that committee for many years. Next slide. And to bring, we've been working at CARB to bring some sort of climate justice framing to their work. And I use this slide as a way of talking about when we think of policy solutions, what are you going to do, right? If we were to just focus our electrification efforts on new buildings, would we be getting to that last one where we've actually really removed the barriers to healthy communities from folks, right? Particularly communities of color who have borne the brunt of the burdens. And so part of the conversation that we are now having with many of our allies is how do we do that? And one of the tools that we've used is the electrification executive order, where the language of that executive order focuses a lot on ensuring that the communities who've borne the greatest burden of climate change also don't bear the greatest burden from implementing policies that seem on the surface wonderful and really good, and we should have them. But often what happens is when you build on existing inequality, you actually deepen the inequality, right? So if you look at the second box, that's equality, right? Everybody gets the same. Well, that doesn't actually work out for folks who have traditionally not been the beneficiaries of policy. So next slide. So this is the executive order, broad range of organizations, really putting in the language that we have been hearing on the ground. So things like protection from displacement, because we know that gentrification and displacement is a major problem in many low-income communities. And we also now are seeing the emergence of what we're calling green gentrification, that projects that were intended to bring environmental benefits are actually pushing out ultra low income communities. And so we have to really get better at doing an analysis of benefits and burdens with our policy, and get better at balancing the sense of urgency that we have to address the climate crisis. But remember that there is an even greater sense of urgency to address systemic inequality and the marginalization of communities of color. And so part of the work that PSR is doing, and many others like greenlining, are figuring out, well, what does this look like? and being really careful about the kind of policy options that we choose. And so next slide. I think that's it. So a lot of the things that we're talking about that we think are important are, language around anti-displacement, ensuring that there are wraparound services, that there is one shopping for someone who's going, for anyone who's going to do a remodel or anything else that might need them to comply with the new standards. The other thing is, how do we work with rental units? And we've had some experience of doing lead work and pesticide reduction work through a healthy homes model. And that's also what we're also examining now, how those models, where we've partnered with community health promoters, local organizations, tenant rights groups, and actually gone door to door and not, can we come in and do an assessment of asthma triggers? Can we come in and train you how to do low risk pest management? That's the kind of outreach we will need to be able to move these appliances out of rental units. And as we focus on new buildings, it actually gives us time to figure that part out. And that's the part we can't forget. If we get to the new buildings part, we're not done. We still have to get to the huge stock of existing rental units and figure out, what are the barriers for communities to switch over. And I think that the health voice is really critical in pushing for those equitable solutions that solve the problems of your patients who are experiencing both the indoor and outdoor pollution, and then standing with the environmental justice community as we figure out those solutions, because they're always harder and more costly and more complicated. So with that, I think I've run out of time, and so I'll stop.
All right, guys, so I'm just gonna be talking about, what we can do as healthcare providers. So, first things first, for those of you who showed up to this webinar, that's great, because there's so much education that we need to do for ourselves about the risks of indoor air pollution. And the EPA actually has a great document that you can look at that goes through individual air pollutants, what are the symptoms to look out for. And this is part of, going into the next point, when you're actually talking to your patients about the symptoms that they're experiencing. This is where, keeping track of what pollutants can have certain effects on our body that really makes the difference. And then, of course, going into the interventions that they can take at home, which I'll touch upon in just a little bit. And then, of course, advocacy and raising awareness, joining organizations like Climate Help Now, or for those of you who are in other states, there are healthcare professional organizations like ours that can, help you to figure out how can you get involved. And in addition to that, you also have your medical societies as well as your member organizations, because again, climate change is a public health issue, and we need to get into this conversation. Next slide, please. Now, in terms of just for individuals at home, so we'll always want to switch to electrification, but sometimes that's just at this point for some people may not be possible. So for a few things that you can just do on your own right now, while we're trying to get these policies into place, making sure that if you do have a hood, running that while you're cooking, opening a window while you're cooking, or using your back burners. And then, of course, making sure that you have a carbon monoxide detector that actually works. And then even in my own home, I previously, when I lived in DC, I had a very small kitchen. So I tended to use a toaster oven, which worked just as well. And then, of course, you also have the options of these plug-in induction stoves that cost about $50. But, these changes can make a difference. But again, on a larger level, we really need to push for electrification. And again, electrification that is going to help all people and not just a few.
And just a quick word on other appliances besides stoves, we do now have great alternatives like electric hot water heaters and heat pumps, which can heat and cool at the same time. RMI has done a lot of work on the economics of electrification and heat pumps working in cold climates. So I think that this is not our grandparents' heat pumps, and it's really evolved, and we're seeing that people who have them love them, not just for the climate and health benefits, but also for that comfort, doing heating and cooling at the same time. And finally, from me, just a couple words. We've put some recommendations together for national and state policymakers, how we can start to address the pollution and health impacts from gas appliances. So we need indoor air quality guidelines. I think we feel that we had a big win recently when the California Air Resources Board said that in light of the new evidence and hearing from advocates, they are going to update their indoor air quality guidelines that have not been updated for 20, 25, 26 years. Not every state has that, so that's great. Those can be really useful when we get to building codes. California, again, just went through a building code process for the first time ever. We see the California Energy Commission requiring differentiated ventilation standards for gas stoves versus electric, recognizing that we need stronger ventilation for these combustion pollutants. Warning labels, many people don't know about these risks, and so how do we raise the bar, raise the awareness? Where's the Consumer Product Safety Commission in this? And really, this is, I think, what Martha's talking about, and where we can't wait to address these thorny issues, which is how do we get gas out of our public buildings, our public housing, our affordable housing, our schools? What can we do for renters, and what kind of incentives? I think the opportunities to use these health benefits to unlock the funding that we know it's going to take to get to these alternatives. So with that, I'm just going to pass it over to Lauren to quickly go through a few more specifics in California.
Yeah, so thanks, Brady. So California has already pledged to phase out gas use and has committed to 100% carbon-free power sector by 2045. And while there are statewide policies to reduce emissions in the transportation and electric sectors, the state and local agencies have not sufficiently regulated the building sector to reduce climate and air pollution in line with climate and air quality targets. And the current indoor air quality guidelines are outdated or unenforced. So there are many policy opportunities in California that we're working on that will reduce air pollution from gas appliances and encourage electrification. And this list that you see here is a list of the important state and local decision makers that we see have each have an important role to play. So I wanted to go over some of the specifics that we're working on. So we're in discussions with the California Air Resources Board, or CARB, and this is the state agency responsible for protecting Californians from the harmful effects of air pollution. So we've been working with them and encouraging the agency to establish stronger indoor air pollution guidelines, as well as to develop a zero NOx emission standard model rule for gas appliances for the air districts across the state to implement. And we've had some recent successes with this work. Last month, CARB passed a resolution calling for the phase out of gas appliances and for stronger electrification requirements for California's homes and buildings in the building code. And also in the resolution, the agency is now committed to updating its indoor air quality guidelines. We're also working with air districts, these are responsible for protecting Californians' health from stationary pollution sources like gas appliances. So we're working with them to update appliance emission standards to reduce pollution from everyday appliances and develop zero NOx standards as part of their state implementation plans. We've also been pushing the governor's office to get more involved by directing the agencies to be more aggressive on building electrification to protect public health. And in terms of legislation, we're already seeing this year, we're seeing legislation being introduced by California, in California this year on this topic. And legislation can be very helpful where there may be gaps in agency authority to cover this issue, or if the agencies fail to be as aggressive as they can be. Next slide. All right, the city and local governments in California have been passing local ordinances requiring or supporting all electric new construction. They've really been playing a leading role in the transition to all electric. And so far, 40 cities have adopted building codes to reduce their reliance on gas and encourage electrification. The CPUC with the California Public Utilities Commission. This regulates privately owned public utilities and services, protects consumers, and assures access to safe and reliable energy. This agency can help ensure utilities make electrification affordable and accessible. It can create electrification incentives, rates that encourage climate-friendly electrification, and new pilots and programs focused on electrification and upgrades for low-income homes. And last, we are also working very closely with the Energy Commission to encourage the CEC to adopt all electric new construction and eliminate gas stove pollution, to make sure that ventilation standards ensure safe indoor air quality for new construction and retrofits. And we actually were able to encourage them to host a workshop on indoor air quality and its health impacts. So we're asking all of these state air regulators and decision makers across the state to collaborate with partner agencies and work together to ensure that building standards, incentives, and energy policies are all reducing air pollution and reducing climate emissions. And overall, we're carrying out the message to these decision makers to inform them that the best solution to reducing pollution and the health risks associated with gas appliances is to transition to zero emission all electric appliances. So thank you.
So we'll share this PowerPoint afterwards. Here's a couple of resources where we pulled a lot of these facts from. And finally, thanks for being here. I know we want to jump to questions, so I will stop sharing my screen.
Awesome. Alrighty, thank you all for that really informative and powerful presentation. We have about 9 minutes to go, so of course there's never as much time for questions as we would want. And again, please feel free to, you can actually even raise your hand or put a question in the chat if you haven't already. One question specifically for Christine, but really for all of you that has come up is we often hear that, you know, more research is needed, more research is needed. We don't fully understand this yet, as sometimes a delay tactic really on the part of industry or other opposition. And I'm curious what advice you have or how to answer that question as health professionals when that comes up.
Yeah, I mean, I think that, no, that's a great question. Oftentimes I feel like when, you know, they're using this as this delay tactic, and I feel that we do have enough research in my mind that shows that there are some serious health effects that come up with this. But I think even beyond that, though, you know, research, as someone who has done research, it takes time for that information to come out. So what would be really helpful is, you know, for us as physicians and other healthcare providers to come into the conversation and really advocate, because we see these patients in our clinics, we see them in the hospitals. But if we're limiting our interactions to those spaces, then those who are outside of those realms, they will never understand that. And that's where I think our role is most important. You don't need to submit this information necessarily to a study. You already are doing all of that on a day-to-day basis. So I think that, you know, just because we may not be able to cite a certain study doesn't mean that, you know, the effect is not there.
Another question we just got asked from Steph Johannes, who's not in California, for anyone who wants to jump in. What do you think is the lowest hanging fruit or best target in states that may be seen as less progressive than California in terms of health professionals pushing for electrification?
I can take a crack. It's a really great question. At RMI, we're working across the nation. And so we've come across this. I can share in Massachusetts, for example, you had one city, a couple of Brookline, who was really going for an all electric building code and has faced numerous challenges. And so the challenges they're facing with the Attorney General's office and otherwise is really helping people figure out who are the decision makers, who are the stakeholders. They've really engaged a lot of grassroots groups, and though they are taking, they're taking a lot of the hits for this one, I think in the long run, the learnings from that will be able to be applied to other cities and hopefully at the state level. So I would say what we saw, Berkeley was a spark. Maybe I shouldn't use that metaphor, but it was it really lit the fire. And I think that working with environmental justice communities, we're seeing this in New York, actually coming a campaign that's being led from those. So I think just finding a champion wherever they are and wherever that can be, and it could potentially come from a place that we may not be expecting. For example, we're starting to see architects really coming into this issue. So I would say cast a wide net and try to find a champion.
Alrighty, I think we're gonna have time for one more question that was just posted, which I think especially for those of us who are in California, this is especially relevant as we've lived through the last few wildfire seasons. But questions that come up a lot about the resiliency of our, as we head toward an all-electric future, and how do we answer this question about the resiliency of the electric grid? And as we face the prospect of blackouts, how does that how can we think about that as it factors into moving toward all electric appliances and all electric everything?
I can always try and take a stab at that. I mean, this is covering other issues too, right? Because we need more energy storage in California, and that will help homes maintain their power as long as you have the storage or the backup. We're also seeing that, a big talking point that we saw during those blackouts was that, we can't electrify and we need to continue to rely on our gas plants. But we found that there were still reliability issues even with the gas plants under these extreme heat conditions. And a lot of them weren't really fully helping. So at least I know that we have to look at a lot of other things, not just transitioning our gas appliances, but really looking at what that means for creating more storage options as well. Martha, I saw that you unmuted. Did you have more that you wanted to add there?
Well, I mean, I think I was going to say, as part of, we are going to be doing a ambassador training where we're really going to dig deep into who the regulatory agencies are and really give physicians tools to engage both at the state level, but there's lots of local stuff that's happening. And so, being able to speak to these arguments about the science, how to use the precautionary principle in your messaging, but also understanding how power functions. Because often we as physicians don't get how power, or I'm not a physician, but we say, well, this is just the right thing to do, right? But understanding how the relationships at the board function, the relationships at the local air districts function, how city council functions, and how to be really effective in promoting the health and equity message. I think that's really important.
Awesome, thank you both. I just am putting into the chat, it looks like Brady put in a link to a blog post from RMI about this exact topic. So we'll take a look at that and we can also link that out in the summary. And then I'm just putting in the link now to the PSRLA Health Ambassadors training program. Marta, is that open to people who aren't in Southern California? Oh, I don't know if you could.
Yeah, can you say that
Oh,
again?
sure. I'm just wondering, is that open to people who aren't in Southern California as well?
Well, it just occurred to me that it'll probably be virtual.
Right.
So, yes.
Okay, awesome. Great. Excellent.
And that's not like a full day, and it's much more intensive, and you get a chance to practice providing testimony and all of it really is in depth.
Awesome. Okay, we will make that information available to through our channels as well. Wonderful. Well, we have about 2 minutes left to go. I can wind things down. Is there anybody else with one last burning question before we start to wind things down? Take that as a no. All righty. So thank you all. Christine, I'm just going to turn it back over to you just to close us out.
Sure. So, so thank you everyone for coming to listen today. Obviously, you know, there's still a lot more to learn about this. Even I am, you know, still educating myself. And we would love to welcome any of you who might be interested in any sort of advocacy work or education. It doesn't even matter what your experience level is. We did put in the presentation today the website link to look up Climate Health Now. We specifically do have our building electrification subcommittee focused on, you know, this issue. And so, you know, please join us to, you know, help us figure out, you know, what we can do better. And then, of course, we do plan on actually having some more lectures on the topic, likely in the new year. One of our main focus areas will actually be on the environmental justice community. So we're hoping to invite Marta back to give us even more information about that. But yeah, if you have any questions, look us up. And then of course you do have my email address, so you can always email me there with any other questions or concerns or ideas.
All righty, guys. Well, I think that is it for today. We are just exactly at 1. So thank you everyone again for joining. I also just put in, for anyone who has additional questions, the email address for Climate Health Now as well. So feel free to reach out that way. And again, to Christine and Lauren and Marta and Brady, thank you so much for joining us and for sharing this information. And we look forward to lots of partnerships in the months to come.
Thank you.
Take care, everybody.
Thank you. Have a great day, everybody.
You too. Bye. Bye.
Thanks, everyone.